the ExteNET study was a trial that looked at using extended HER2-directed therapy with using neratinib, so a pan-HER2 tyrosine kinase inhibitor, for 1 year after patients had completed their HER2-directed therapy with trastuzumab-based treatment. It's important to realize, however, that ExteNET was conducted when pertuzumab and T-DM1 were not being used in the early HER2-positive disease setting. And so the trial did demonstrate that taking neratinib for a year after completing your year of trastuzumab did result in a reduction in disease-free survival events. So there was about a 2.5% difference between the two arms. But what was really interesting is that this benefit seemed to be restricted to those patients who had hormone receptor positive disease, where we saw that the difference between the two arms was about 4.4% in those patients with hormone receptor positive disease, but really saw no difference in those patients with hormone receptor negative tumors. There was an interesting analysis that was done that took patients who had received preoperative HER2-directed therapy and had residual hormone receptor positive HER2-positive disease, had then completed their year of trastuzumab and then had gone on to the ExteNET trial, and did show that there was a 7% absolute difference between those two arms favoring a year of neratinib, again suggesting that in that population where we're traditionally giving, for example, T-DM1 and at this time, that those patients, again with sort of high-risk residual disease, do see an even larger benefit that was seen in the overall ExteNET trial. I think the challenge is how to then use these data in the current era where we are giving pertuzumab and T-DM1, where we really don't have data for what the efficacy is of neratinib in this particular patient population. And so I think in my general practice, what I say is that if a patient had a very high-risk hormone receptor positive tumor, for example, a patient that may have had residual disease after preoperative therapy with multiple nodes involved, I do consider giving neratinib in those sort of high-risk patients, again, acknowledging that we don't have sufficient data to guide us here to know what the benefit is if someone had received previous pertuzumab and T-DM1. But again, would say that those patients are at high enough risk of recurrence where potentially extended therapy may be of some benefit.